The first thing I want to say is congratulations, because you are about to make a huge step in regaining your life. So many patients come to us with the initial symptoms of depression and anxiety, irritability, mood swings, brain fog, very hard to focus, afternoon fatigue is hallmark, not being able to sleep at night. Women get night sweats, some men get night sweats. And the reason all of those symptoms happen is because of testosterone deficiency. And for you women watching, a lot of women don't even know that we make testosterone and we need it. The inner core of the female ovary makes testosterone and the outer core makes estrogen. And as women age, our ovaries age from the inside out. So we lose testosterone 10, 15, 20, and sometimes more years before menopause ever kicks in. So all those years in our 30s and 40s when we're depressed and moody and anxious and we can't focus, and we go to our doctors and we're given a myriad of prescriptions for antidepressants and sleeping pills and anxiety pills, that's really not the fix. So what we're about at BioT and your practitioner is about is getting to the root cause and correcting those imbalances in your hormones, primarily, first and foremost, testosterone deficiency. Now, for women that are menopausal or postmenopausal and going through that estrogen decline part of life, we call it hormone havoc, it's kind of crazy. It takes all of those symptoms of testosterone deficiency kind of to a next misery level, if you will. That's when hot flashes, which are a flushing that starts deep in the core and creeps up your neck and face, lasts about 30 seconds or more. That's a typical sign of estrogen deficiency hot flash. Some women get them, some women don't. Some women get 2 an hour, some women get 2 a minute. It's really variable and everyone is different in that symptom. As some other symptoms of estrogen deficiency are bladder and vaginal symptoms, incontinence, urgency, frequency, and so forth. These are all of the things that we are going to look at when you see your practitioner and get those things in balance. Some other things that we really hone in on, because it's so important not just to look at your estrogen and testosterone and progesterone if you're a female with a uterus and you haven't had a hysterectomy, is your thyroid optimization. So many women, especially postmenopausally, are suffering from what we call type 2 hypothyroidism or thyroid resistance. And that is where your thyroid numbers look in the normal range, but really you're very symptomatic for low thyroid. And some of those symptoms overlap low testosterone, such as energy, weight gain, cold hands, cold feet. These are all telltale signs. And as it gets lower and lower, hair thinning and eyebrow thinning and many other symptoms. We also look very closely at your vitamin D levels, because vitamin D, although it's called a vitamin, it really is a hormone. It looks and acts like a hormone in our bodies, and it plays a big role, and there's a lot of synergy between vitamin D, thyroid, and testosterone and estrogen. So all of those symptoms that brought you to your practitioner that I mentioned are really what we're going to be looking at from the hormone standpoint. But a couple of things I really want you to understand about balancing your hormones and testosterone specifically, some non-tangible benefits, if you will, those things that you can't touch and can't feel, are the many, many studies that show testosterone specifically to be highly breast cancer protective. Hundreds of studies show that testosterone decreases estrogen stimulation of breast tissue and therefore decreases our breast cancer risk. It's also a powerful bone builder. We have patients that have built up 8 to 10% of their bone density over the course of 1 to 2 years on testosterone pellet therapy. Alzheimer's disease risk reduction for women is 50%, men is up to 70%. So what we're finding is hormones in general, and specifically testosterone, plays a really key role not only in how we feel and how we look, but how we age and our long-term health benefits. Some of the questions that you might have for your practitioner may surround your dosing, may surround potential side effects, may surround how long do I have to be on this therapy. So I'm going to address a couple of the most common questions that I hear in my practice. The first one is, how quick am I going to feel good? Well, the pellet implants take a little bit of time to start working. So most people say the first week, as their symptoms start to lift, the sleep is improved, hot flashes go away right away if you're having that problem. By the second week, the mental clarity, mental focus is coming back. And by the 3 to 4 weeks, when you're on your way kind of to the peak, that's when the energy surge, libido surge for women kicks in, and so forth. Really, this therapy, when done properly, has very minimal side effects. And I say when done properly, and that is a key thing to understand about the BioT method and what your practitioner is doing for you. When they are dosed individual to the patient and done properly, the side effects are really none. There could be some nuisance side effects of hair growing faster. You know, we have a lot of women that complain that they have to color their hair more often. For patients that are out of balance with their estrogen and progesterone, for instance, if you are a postmenopausal woman that is going to receive estrogen and you don't take your progesterone properly, you can have side effects of bleeding. So there are some side effects. They're all manageable. There are no permanent side effects with this therapy. And again, really minimal side effects to none if it is dosed and done properly. So I hope this information was helpful to you. I'm sure if there's any other questions that you might have, your BioT practitioner will be happy to answer them on your visit. I wish you well.